I really actually enjoyed our group discussion, and it really does lead very well into this next section on attribution techniques. Given the content of the questions in our group, and I imagine there'd be some similar themes in the other groups as well. So I think I'll just launch in, and I may even skip over some of the introductory things just because I'm not sure you guys need it. Majority of the information I tried to get from the manual to stick to a single source that's already available, and this is the manual that you can find online to take a look at for any further detail. But just quickly to some definitions. When we say attribution, we're talking about assigning some quality or character to a person or thing. We hear often in borderline personality disorder, we hear about splitting, and that is indicates a polarization of attributions of self and other into all good and all bad. But if you look at polarized, generally speaking, you can become polarized in a conflict. You can become polarized yourself, or you can induce polarization in somebody else. And if you look at one of the most common topics, if you Google this, is politics, not borderline personality disorder, which makes actually a lot of sense given the recent election. So polarized attributions can manifest themselves interpersonally, which we talk about a lot, between self and other. I'm bad, they're good, I'm bad, or flip that. And between self and multiple others, where this is where we can get splitting in a team where, one person can be all good, the other person can be all bad, but it all relates to different aspects of ourselves. And also, we can have interpersonally between different aspects of the self. I think someone asked this question a little bit. You can have different aspects of yourself. For example, if I trip over something that I left in a room previous night, I can be like, oh, you're such an idiot. And in this state, I am not in a reflective state in a moment. I am calling the other, which happens to be myself, an idiot. And the self is actually feeling pretty grandiose because I know not to leave things in the room. But I did. But in that moment, I am not linked up with those two sides. And so there is an other and there is a self. And so that can also occur. In social psychology, it's actually pretty, splitting or black and white thinking or polarized attribution is very common. And so we can have multiple others come together as a us or a we. They're like me, and this other group is not like me, and it becomes polarized, simple, distorted, not complex. Okay. The mechanisms behind polarized attributions likely related to, again, similar to reflecting back on what Dr. Gregory was talking about, related to the limbic system, as it temporarily can dominate our more I guess, advanced or prefrontal cortex, and it can result in, and it tends to do that when we have a perceived immediate survival threat or need that we're responding to. So you get an amygdala response, you have a fight or flight system gets activated, and we can also have the seeking reward system, and all of a sudden, the fact that we went on a diet 4 hours ago, and that we see that cupcake, we need to have it right now, we are in a split off affective state, and it is all good, and the diet is all bad. In that very brief moment. So the limbic system can shut down or dominate, because it doesn't necessarily shut it down, our prefrontal cortex in these situations. And again, this is common in politics. I won't go into, there's some interesting papers on this with amygdala forming in terms of group norms, but we'll kind of breeze through that. One of the interesting things, though, is that they studied is that sophisticated individuals who are already polarized, Democrat, Republican, when they get information designed to contradict what they're thinking, to start to bridge the gap and make it more complex, they will read the information and come out more split than they were before. And they will unconsciously ignore everything that goes against what they already believe, and they will actively look for whatever they believe And the more sophisticated someone is, the more likely they are to do that. So education is not, this is where education is not power. Knowledge actually goes the opposite direction. You can get like a 12-year-old kid, integrate it just fine, and it becomes kind of comical. So in people with borderline personality disorder, they manifest these polarizing attributions. We all can do it in situations, but they're manifesting them daily in their interpersonal lives. It's pervasive, it's severe, it's almost every day. They're battling some kind of situation that results in them polarizing, having a polarized attribution. It's likely mediated by the limbic pathways, as we said, either the amygdala, fight or flight, or the seeking system. It becomes a major contributor to the suffering of the individual because the actions that they may do in the context of being in a polarized affective state does not necessarily lead to further group identity, socialization, which is very different than a political situation where everybody could be, at a rally or something for a political party, and everyone feels together. Whereas these situations, these interpersonal situations that occur on a daily basis, tend to be more isolating than they are bringing people together. So it's almost as if something that's helpful for us, if used infrequently, becomes our own torture. So, and it's interesting too because they become both a cause of our suffering, these polarized attributional states or affective states, but they also are an effect from our suffering. So the limbic system fires, then we start to go into polarized state, we do a polarized state, we do things we regret later, limbic system fires again. So it's both a cause and effect, which is tough. So how do we intervene? Just as with the previous example in normal populations, when it comes to the Republican Democrat issue, the only way to resolve it is going to have a third other who's neutral and perceived as safe and not taking a side, and will actively integrate. It has to be an active process to integrate the different sides of the coin, or else it will not occur in most instances on their own. So a safe neutral other is the most efficient means to resolve polarized attributions. And just as with the previous example, which I actually didn't get into the details of this, but non-affectively charged data or theoretical data, which can be polarizing to, let's say, some theoretical somebody else. My experience has been that people with borderline personality disorder integrate it just fine. It's only when it's affectively charged for them that all of a sudden it becomes an issue. I was just reading this book on Note Will, and I was just joking with Rob a few minutes ago how they had this experiment. The experiment with the M&Ms, that through the 4-year-olds, who delays gratification, but who takes M&Ms. And there's a recent experiment where they had chimpanzees versus Harvard students. And they made sure the Harvard students knew exactly what was going on. They know what they don't want to do. They don't want to have the M&M. They want more M&Ms. They're hungry. In a theoretical situation, they had it down, the whole setup. Train the chimpanzees. 80% of the chimpanzees, after 120 seconds, held, waited, got the more M&Ms, ate them. Only 20% of the Harvard students did that. 80% of them just ate, they couldn't take it. As soon as the M&M was sitting in front of them, all of a sudden, the limbic system took over. The reward system there, prefrontal cortex shuts down. Not shut down entirely, it just gets dominated. Because what did the limbic system do? It actually hijacked the prefrontal cortex to give you some rationale as to why you want to eat that M&M, right? Prefrontal cortex is lighting up saying, well, the reason I'm going to eat the one right now, even though I said before I was not going to eat it, is really because tomorrow I'll actually do this experiment. And I'll do it tomorrow. But right now I really want that. And it sounds perfectly reasonable. Prefrontal cortex gives a rationale that is completely in the service of the limbic system and the reward system, had no freedom whatsoever. The part of the prefrontal cortex that would kind of weigh the whole options, reflect back and remember that you just said 5 minutes ago you were not going to do this, that part is shut down. That part's shut down. So the limbic system is dominating the prefrontal cortex in these experiences. Also, with borderline personality disorder, that's very difficult. Is that even when we start to be able to integrate different aspects of polarized, just because we do so on the surface level, it doesn't mean it's gone. So, for example, and you're telling some of your narratives, you say, well, I felt like a bad person here, but I also felt like a good person in these other ways. You start to integrate those things. Just because you can do that on surface level topics does not mean that polarized sense of badness is gone. It's just, you have to it's like peeling away the onion. You start off on very kind of simple topics, very relevant topics right now, a surface level, and then as soon as you start to integrate those things, you start to uncover more polarization. So it's very strong and very fundamental and core, even if you've already seemingly on the surface addressed a lot of these things. They can seem to integrate these attributions perfectly fine. Why is it that it's still difficult? And it is. It's still difficult. Once you start to peel these things back, there's still that fundamental sense, and it takes time to really get through it all. So I really like the peeling of the onion analogy. So my advice when it comes to these things, when you're thinking about integrating polarized attributions, and actually also developing narratives, and it's similar to what Dr. Gregory was saying, is to start superficial, right with a story that they have, not trying to lead them with some big grand interpretation. It's just start right where they are. Start simple and small, and be patient. At times, the people will start to recognize that they were able to integrate these things in ways that they didn't previously. They'll feel fairly good about that, and you can enjoy those little successes so long as you keep in mind and that they're little. The overall picture still takes time. And that the path is more important than the end. I liked, if you remember Dr. Gregory's data, the path was not over once the therapy was over. In a way, they're kind of put on a trajectory. And in the next 18 months, despite not seeing the person once, it was getting better. So it's the path that you're setting people on. You're not looking for the end. Not looking for the end. Oops. Therapeutic stance for attribution techniques is the same as it is for narrative work. You're warm, empathic, non-judgmental, neutral. You're not here to tell them where they should go. You're there to explore. Exploratory. This is where I use the word exploratory because you're not passive. You're not passively listening to somebody's story. And whatever they tell you, they tell you. Yes, they pick the topic, but you are actively helping them explore it, very proactively. In fact, as some of you may have realized, it's actually fairly difficult to really help someone explore and help them get in touch with their experiences. Because we ourselves want to jump. You know, it's just easier to jump than it is to go through the details. But we do allow the patient to lead the way in terms of the topic. And so far, in my experience, the fastest way to help the patient see and understand themselves, get in touch with their experiences, is if the therapist and the patient work to see, understand, and experience these things together. So it really is a dual process. And warm and empathic, it's obvious in theory, but as Dr. Mastada is going to talk about tomorrow, and all of us, I think, have that experience with, it is not so easy in reality, and we more notice it when it's gone than we do when it's there. Attribution techniques are actually used throughout every stage of treatment. It may not be so specifically stated as so, but we use it right from the get-go. Even from the very beginning when we establish the frame of the treatment. You know, patient can come in and say, I'm incredibly excited, I cannot wait to get started, I am ultra motivated, I am going to change my life. I just found out about this treatment, I'm jumping in and we're doing it. And when I first started, and sometimes I still get caught up on this, I'm like, yeah, this a motivated patient, finally, we're going to make some progress here, right? But all the experienced therapists in the room, you know, immediately recognize that this is not the end of the story. Because as it turns out, if I'm feeling guilty about eating that cupcake that I just told you about, if I resolve to never eat cupcakes again, that boost dopamine solves the limbic system problem just in the resolve. With not a single behavioral change whatsoever, I feel better about myself. So it's the resolve, which is what brought down the whole guilt feelings about the cupcake, not me actually resisting cupcakes. It was just the resolution part of it. So then we walk into the room. I think I was reading Dr. Bustada's Lacan book a long time ago, and so people don't really want to change; they want to change how they feel. And immediately, in that present moment, it's the case. Both are actually true. You want to change how you feel, and in the very beginning, experienced therapists know this well, that we immediately kind of look into to try and establish kind of more the real here. What's really going on? So we explore the core motivations of treatment at length. We educate the patient about the entire process. It's a big commitment for both of us, patient and the therapist. You explore the likely potential stumbling blocks. You're predicting that 100% gung-ho is not going to last very long. I'm excited if it lasts 2 weeks. And that there's going to be you explore the ambivalence, because why hasn't it not changed already? There's ambivalence. If they would have changed, if it was easy, it'd be done. It would have already been done. So after all is said and done, the idea, and something I've tried to make a policy, but I don't always succeed at, is to still even hold. I've explained everything, we've reviewed everything, I feel like this is a good idea. I still try and tell the person, why don't you think about it for a week and then come in and then let me know whether or not you still want to do this. And when I'm really off to the races about how fantastic this person can be to work with, and I can predict they're doing well and all this, it's hard to say, let's hold. And let's wait the next week. Come in, tell me what you think. And so you're already establishing, you're already, even though you're not doing it specifically, you are going after integrating polarized attributions about recovery itself. Then in stage 1, you kind of learn, am I safe here? And then a narrative work. Narrative work also challenges polarized attributions intrinsically without ever consciously doing so. If you never ask, what is the opposite or this or going after these things, it intrinsically does some of this work already just through the process of narrative work, especially the top layer of the onion. You start off here and you first see a person, you had a meltdown yesterday for no reason, it was awful, can't take that ever again. I felt like if I don't get out of this now, I'm going to either going to die or kill somebody else. And that's it. That's all you get for narrative. And then you start to make it a little bit, how did you get through this? And it's like, well, a friend of mine gave me some pill, I don't know what we call it, and then I felt better, and all of a sudden everything was right with the world. And so it starts out very simple, black, white, very simplistic narrative. But then you start to say, well, what exactly happened here? So, well, I was at a party, and I was actually feeling pretty good, but then there was this girl I was talking to, said something that's kind of clearly, rejecting me. Then I felt awful. Then this friend of mine gave me this med, some kind of pill he had, and that's why I'm here to see you, by the way. And then I felt better, right? So it starts as kind of budding, kind of simple, starts off simple, still black and white, but you can already kind of see how you can start to kind of very quickly, I just got this from Google, I was looking for maps on the thing. It doesn't take long if you're really developing a narrative to see how complex, very quick it can get just doing narratives. The very simplistic, I just feel like panic, and now I just feel better, is no longer a plausible argument, even just by developing the narrative. Everything shifts into much more complex and nuanced fields just by doing the nuance. And I love this picture just because it's like you have this interaction of trains, you get these little interactions, and you can go in directions, once you start to explore these things, that we don't know where it's going. At first, when you first see the patient, you know exactly where this is going. We could have all predicted in the room what the patient's going to say next, but now we don't know. When you start developing the narrative, you just don't know. So using narrative work alone does a great deal of work to helping to integrate polarized attributions. It starts off being just like something like rage, dread, anxiety, depression, or even just expresses behaviorals, I'm going to kill somebody, into an entire web of events, emotions, actions, experiences, which become very nuanced and dramatically alter not only the perception of these recent events, but also of the fundamental polarized attributions that will drive them for future interactions. So that it very quickly starts to shift things. Just by that. Okay. Then, so for example, in just developing narratives, in the process, it's very common for people with borderline personality disorder to present, I'm just crazy. I think we've all heard that. So I'm just crazy. By doing narrative work alone, developing that map, that already strongly challenges that notion. Because once you develop the whole scenario of events, all surrounding the emotions that occurred, the crazy is disrupted. That polarized attribution of the self as crazy gets disrupted relatively early on. Now, the sense of badness may take a long time, but the sense of crazy it's not that long. It can return, but it's fairly dramatic. So you are already disrupting polarized attributions. Things start to make sense. We can see them as valid, appropriate, and not valid and appropriate because he told them it was valid and appropriate, but because the exploration of their real narrative, their real experiences proved it for themselves. All right. However, despite that, it does turn out to be helpful to use a few other techniques to help further integration besides just narratives. Polarized attributions, as you're doing narrative work with a patient over time, you start to develop those complex maps, begin to become increasingly apparent. That in one day, the person will be seeing things like this and have a nice complex web around it. Another day, the patient may be seeing things like this, and they're totally opposite and have a nice complex web around that. But yet the distance is, it seems like impossible to meet, and it would be, theoretically. So once a safe relationship is established, narratives are developed enough, these things start to become evident. The stage is then set to broaden the exploration further through some more active interventions to disrupt the black and white thinking through active therapist-initiated processes. So again, it's not a passive process. Even though we're exploratory, we're neutral, it's a dynamic stance, it's not a passive process. And I found this in indexes I was looking through for string theory. But I found this really cool thing of a wormhole connecting two different areas of the galaxy, right? So you develop this nice web of a map of interactions on top. You have a web down here, and then a therapist comes in and draws this link together. It does it again with the Democratic Republic. It is not going to happen on your own. But someone comes in, a neutral, warm, good enough, safe enough third party, and you can make this link. And this ends up being huge because it could take a long time to make that link outside of that. So again, with those things, start simple, concrete, and small. Use current and previously gathered narrative data effort. I would really just stick to the data given. Don't expand beyond the data given. Avoid expansive interpretations or assumptions. They sound really good at the time, but in hindsight, when you look back, it's like, oof. It never sounds so good in hindsight once we've kind of gone back and thought that our brilliant intervention wasn't so brilliant. So for example, so from what I understand, you found your friend last night to be kind and understanding. Bringing in what you told me about during the one incident 2 weeks ago, it seems like at times she could be kind and understanding, but at other times she can be callous and dismissive. Does that sound accurate? And I'm thinking the patient actually said those words, callous and dismissive. I'm not drawing some interpretive thing, and they never use those words. So I'm sticking it's concrete, it's specific, it's simple. I'm just bringing in my memory of a previous session to integrate this person's friend, their relationship with this person's friend. And also be aware that polarized attributions of the self, therapists, and parental figures are so highly charged that it is incredibly difficult to integrate those early in treatment, and I would advise not doing it. It doesn't end up working out so well, but these interactions that occurred in the recent few days with friends, associates, all these are very fair game. Another thing that we could do, so we have data. One technique, kind of bring in data of opposing attributions, and as soon as you bring it in, it will be the first time they've ever thought of it. Oh wow, it's amazing how the links in that moment. So another thing to do is to ask about alternative emotions to something. So directly ask for alternative emotions that patient may have been experiencing within a context or narrative. Another thing we could do is when a patient demonstrates an emotion in the room, all of a sudden, let's say they start feeling sad, and they say they're feeling sad, ask about any alternative emotions. And if the patient is struggling to label an emotion or label alternatives, you can give them a few options to choose from. So not only do we do kind of polarized attributions from kind of a context or narrative or a bunch of data, but we also do it with emotions. Oh, I just felt terrible. Well, I'll give you an example. How did I feel after I went berserk on my sister with her boyfriend sitting right there? I felt awful. I was so embarrassed. And then you can experience any other emotions in that moment. Now there's a pitfall here with doing it right away, which I'm going to get into, but that would be an example of there could be other things. Like let's say, for example, the sister had always wanted to stand up for her, to her sister, this patient, and always felt like she was just a doormat. And she finally stood up, and yeah, she's embarrassed, but she also felt empowered. And it just takes a while to get to that. But there's more to the story than first blush. And that's almost always true. But there's a thing that I find that this is so much easier to talk about than to do. So I feel like this tip, it kind of holds true for me anyways. If I'm actively engaged with the patient, I don't expect myself anymore to be more cognitively flexible than the patient is in any particular moment in time. And I think this is, I found this most humbling when Dr. Gregory when we first started working with borderline. Well, you can give a list of emotions and you can have the patient pick from them with alternative emotions. So for example, in this previous example, I'd be like, so did you feel, alternative emotions, you feel awful, terrible, shamed? I'm saying emotions that are almost the same because I'm empathically in tune with the patient. It's not so easy for me to pick emotions that are outside of the realm when I am in tune with the patient. Just like it's not easy for them. So I would realize that you may also be in a cognitively restricted frame of mind when you're doing this. The alternative emotion that you're likely to give will either be very similar to the emotion or will be totally based on likely an enactment, which Dr. Mustad is going to talk about tomorrow. So, did you experience any other emotions? And the patient says, oh no, very common. I felt awful, I was so embarrassed. Did you experience any other emotions in that moment? No, I just felt awful. And then they look at me like, what do you mean I should feel any other emotions? And then I'm like, I'm stuck too. And for example, and then I just give my laundry list of emotions that sound just like the emotion that they told me and wasn't very helpful. What I have found helpful are tools such as the backside of your kind of emotion thing where you have like a list of emotions, both the painful and pleasurable emotions. And I have found that very helpful to get out of both of our heads and to list a neutral, non-judgmental breadth of emotions that the person can be experienced. And I'm always shocked by how many they start to hit boom, 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 boom. And it's really not so constricted after all. So, tip number 2, same as tip number 1. If any particular emotion you actively engage with the patient, don't be surprised by how cognitively inflexible you are. Therefore, if you volunteer alternative emotions to be helpful, you may bring up a repressed or split off emotion and step right into an enactment, which Dr. Mastada is going to, and usually when you do so, before I would feel silly as I'm like trying to give them some emotions and I can't get out of it, what they're feeling. Right now I feel righteous. I really want them to see a different emotion that they could be feeling. And as soon as it leaves my mouth, I realize what I just did, and now it's too late as it's floating over there. And when we're doing attribution techniques, it is very easy to have our prefrontal cortex be dominated by our limbic system, and is the tail wagging the dog, or the dog wagging the tail, or the tail wagging the dog. It's very easy. Enactments can come through loud and clear in the name of integrating polarized attributions. For example, patient I called my grandmother a B yesterday. I was just so angry. Pause. And let's say in a moment you're just thinking, who would ever call their grandmother that? And you're identifying the grandmother, barely containing the disgust. Did you also feel guilty? Did you feel? You're just right. Ashamed. Did you feel bad about yourself at that? I mean, come on. It's like you really, you're right there. You're not identifying with the patient. You're just as cognitively restricted as you were in the previous example when I couldn't get out of oh wow, I feel so embarrassed for the person. Now I'm feeling the opposite of what the patient is experiencing in the moment. And I jump right to the polarized attribution, thinking I'm doing something good. That's what we learned in DDP. And all I'm doing actually is an enactment of what everyone else has been telling them their whole life. As soon as they're feeling badly, they do something. Why'd you yell? Not neglecting the person underneath the yell. Why did they yell? It's actually a complex story. So attribution techniques can very easily be hijacked. Another one, I moved out of my parents' house and with my boyfriend the other day. I am so glad I did. That they were being so mean, and if you're really thinking that was a bad decision, you're like, oh boy, you know, this person's like 19, on her own, living with a boyfriend was kind of not so good. Boy, I really think things are better off in the family's house. You're really worried. Are there any other reasons they may have been yelling at you like that? Attempting to kind of contain yourself, you blurt out, like maybe they're concerned about your safety and well-being, which is not going to fly very well in someone's attempting to kind of demonstrate their individuation. I'm an adult, I can handle myself, and you're saying, no, you can't. You can't handle yourself. You need these people to care about you. And kind of take their legs right out from underneath them. In the name of integrating attributions, it's very easy for us to actually not go down a good path. So be wary of any strong urges to integrate polarized attributions. Be patient, wait, process the entire narrative, including the current stance, no matter how polarized, before integrating. So my advice is not to just, when they say something and then give emotion, is not to immediately go for the alternative emotion, especially if it's charged, and especially if you have a very strong urge to do so. Really process it, and then go back. You'll no longer have an urge to go back. Then go back, and then you can process the other side. And now that they feel valid in their own point of view, they'll very quickly see, well, maybe it was a dumb idea. My boyfriend is kind of unstable, and I actually do kind of, they'll bring it up themselves once you kind of just wait. Again, and then we got to finish up here, bringing in the attribution techniques along with the narratives. I just love these kind of physics theories. In a way, what you're doing is you're integrating all these polarized states that are split off, and you can start off black and white, and you can become integrated into this multi-dimensional figure that has all sorts of facets. And in string theory, you can have more than 3 dimensions. And this is actually a picture representing, like, I think it's 15 dimensions in a 3-dimensional object. Once you kind of combine a narrative work and polarizing attributions together, and you get through the second stage of therapy, you actually get I've noticed, quite a significant improvement in a lot of the core borderline symptoms, temporary improvement. And a lot of the core symptoms like mood lability, a lot less of these kind of interactions that end up so polarizing. They're interacting better with their friends and family. They find themselves more able to relate to others, other complex others. Now they're not so simple with themselves, and they find themselves in a temporarily better, temporarily happy place as those symptoms kind of resolve quite a bit. You'll see it take off in functioning, but I have actually. It is temporary, as we'll talk about tomorrow, how once it becomes very difficult now that everything, yes, you're relating better. Yeah, you may not outwardly look as borderline as, let's say, you did. But now, all of a sudden, with everything so complex and confusing, and you see all your ambivalence about everything, yeah, there's a part of me that wants to do this, part of me that wants to do this, part of me that wants to do this, and they have all these different things. It's confusing. And the fire is actually to symbolize not only the temporary good feeling, but also the Cortez burning of the ships. When he came over, Cortez was smart and said, as soon as my guys get into battle, they're going to want to flee. And when they flee, they're going to want to get on their ships. I'm going to burn their ships. So he burns their ships, so when they go into battle, they have to stay there. And part of the narrative work and attribution seems to burn. It's almost like you take the outer skin of the onion and you just put it in the fire. And you can't go back there, and then you try, which, in stage 3, it can feel like you're out in the middle of the ocean. Sometimes light, sometimes dark. For quite a while. It's confusing, so it's difficult. But I'll stop there and any questions? Make sense? All right.